Hello, Bremer County and all of Iowa. Welcome back to Deciding Iowa. I'm Dr. Sean Ellerbrook, and I'm a cancer scientist, biochem prof, and House District 57 candidate.
And I'm Dr. Emily Bavers. I'm a physician, mom of 3, and a health advocate.
Since healthcare is a big concern for Iowans right now, rising costs, reduced access to health, especially in rural areas, and workforce shortages are on the minds of many.
Right. And not to mention health concerns like water quality and rising cancer rates. These issues affect every Iowan regardless of their age.
For sure. And what has the legislature been up to improve Iowans' health?
Well, some good news, at least for the patients that I care for. House File 2564 allows for pregnant minors to consent for their own labor and delivery care.
Okay.
This is a big win for young mothers-to-be. Currently, a 17-year-old mother can consent for care for her infant, but she cannot consent for care for herself to get emergent labor and delivery treatment like cesarean sections, epidurals, or even blood transfusions in a life-threatening emergency. So this bill will streamline care, and it just makes good sense to empower a mother-to-be.
All right, that's a good bill. You know, another bill that's passed, House File 2635, helps to reform health insurance authorizations. It basically says insurance programs cannot downgrade services, and denials must be decided by a clinical peer.
And it also exempts cancer screenings or emergent care from requiring prior authorizations, which should make those services more timely.
Oh, that's good.
Yeah.
So those are both positives, and I'm grateful when everyone in the legislature works together to make healthcare, better for Iowans.
Yep, it's a great thing. But on the flip side, House File 571 is a bill that allows medical providers or clinics to refuse providing medical services that go against their conscience, except in cases of true life-threatening emergency.
You know, what is tricky about this bill is that it has been legal for providers to opt out of providing care for that goes against their ethical, moral, or religious beliefs for over 50 years.
Right.
Thanks to the federal church amendments.
Yeah, exactly. It sounds like this bill is more like Iowa's elected officials pandering to politics rather than solving some of our big healthcare issues. It will do nothing to improve the care of Iowans.
That's exactly right. In fact, it just legalizes blatant discrimination against patients. Right. It is neither good healthcare nor neighborly, good sense policy I would like to see in our state.
Yeah. Well, what about water quality? Is there anything else on that front?
Not really. No progress on water or water monitoring. Also missing anything that promotes entry into or retention of the Iowa healthcare workforce.
And also missing is anything that stabilizes clinics or hospitals to help keep their doors open.
And also missing is anything that tries to make healthcare more affordable for Iowans.
Well, it's getting harder and harder, but try to be well, Iowa.